Shoulder impingement is a painful condition which is caused by an irritation of the deep tendon layers in the shoulder, the rotator cuff tendons, and their overlying protective soft tissue which is called the bursa. And those tissues can become inflamed, normally when they're irritated by rubbing on the overlying bone at the tip of the shoulder blade, which is called the acromion. You'll normally feel pain down the side of the shoulder and into the upper arm, and it's worst when the arm's lifted away from the body, particularly above shoulder height. Nighttime pain is something that patients tend to feel particularly frustrating. So shoulder impingement is diagnosed firstly with a clinical examination, so we'll take a history from you to find out the distribution of the pain and what's caused it to come on. We'll normally arrange x-rays to make sure there's no arthritis in the shoulder or any build-up of calcium within the tendons, and then often, particularly if there's been any trauma, a scan such as an ultrasound scan or more commonly an MRI scan is very helpful to make sure there's no extra diagnoses or tendon tears within the shoulder. So surgery for subacromial impingement is normally keyhole surgery, so it's known as arthroscopic subacromial decompression is its technical term. It's a day case operation, so you're in and out of hospital on the same day. And what we do is, usually under a general anaesthetic, make 2 small puncture wounds, one at the back and one at the side of the shoulder. And that allows us to access that space and use specialist instruments to clear away any inflamed tissue, any scar tissue, and then have a look at the underside of the bone. And if we find roughnesses or bone spurs that have been causing the irritation, we can shave those flat. And that allows space for the rotator cuff tendons to move more freely and for the inflammation to settle down. People who come to surgery have normally been through the whole gamut of treatment of painkillers and physiotherapy and injections prior to getting to the surgical point. So it's actually relatively rare that people need surgery for this. The outcome is normally very good. Pain relief is normally quite quick. One of the surprising features after shoulder surgery is how uncomfortable it is in the early stages, but that settles relatively quickly. People are normally back to work by between 2 and 6 weeks, depending on how active the job is. You'll be back to driving normally by about a week after surgery, and light sports can start between 4 and 6 weeks after surgery, but anything that involves overhead or repetitive movements such as front crawl and swimming, we'd normally ask people to keep away from that for about 3 months after surgery.